Today, the topic we are going to discuss is breathing problems in children. It feels like an inability to breathe in and out with ease, which can occur suddenly or develop over time, and may be accompanied by other symptoms, such as wheezing or coughing. Dust, injury, exertion, breathing in a certain substance, particular times of the year, allergies, stress can make it worse. Healthy infants can experience rattling or noisy breathing until up to 5 months of age, while their respiratory systems develop. On your patient visit, you will ask him about his child anxiety, change in voice, drooling, sore throat, trouble swallowing, decreased eating, cough, coughing up sputum, wheezing, blueness of lips or fingers, fever, chills, weight loss, chest pain, ankle swelling, confusion, lethargy. The doctor will also want to know if there is a history of exposure to dust or whether the child has inhaled a foreign body, how long the breathing problem has gone on, and whether the child has ever had a chest X-ray, and if so, what it showed. You will want to know if the child or anyone in the child's family has had any of these conditions: asthma, lung disease, heart disease, cystic fibrosis, pneumonia, tuberculosis, measles, other recent infectious diseases, allergies to drugs, eczema, hay fever, emphysema, respiratory failure. Your doctor will want to know if the child is taking any medications, including steroids, asthma medications, antihistamines, decongestants, allergy shots, antibiotics, inhalants, beta-blocking agents. You will do a physical examination of the child, including the following: temperature, pulse, respiration rate, weight, checking throat for swollen tonsils and redness, thorough neck exam, checking for flaring nostrils, listening to the chest and heart with a stethoscope, thorough skin exam, checking arms and legs for swelling or blueness. If a patient comes to you with symptoms like attacks typically caused by exposure to certain triggers, nighttime cough, he might be having asthma, which is recurrent attacks of wheezing, coughing, and shortness of breath brought on by certain triggers. If a patient comes to you with symptoms like fever, rapid breathing, wheezing, flaring nostrils, more common in infants less than 6 months old, he might be having bronchiolitis, which is infection of some of the tiny branches of the lungs. If a patient comes to you with symptoms like barking cough, wheezing, fever, hoarseness, typically appears after a cold, more common in children between 6 months and 3 years old. He might be having croup, which is infection in the voice box. If a patient comes to you with symptoms like vibrating sound during breathing, muffled speaking, sore throat, trouble swallowing, fever, drooling, most common in children between 3 and 7 years old. He might be having epiglottitis, which is infection or inflammation of the flap in the back of the throat that blocks air passages during swallowing. If a patient comes to you with the following symptoms like sudden onset of breathing, trouble, anxiety, chest pain, adolescence, lightheadedness, tingling around the mouth, numbness in hands, more common in children older than 6 years. He might be having rapid or shallow breathing, which is due to hyperventilation. If a patient comes to you with the following symptoms like coughing up sputum, high fever, rapid breathing, he might be having pneumonia, which is infection of the lungs. If a patient comes to you with the symptoms like sudden onset, may occur after chest injury, more common in children with asthma. He might be having pneumothorax, which is collapsed lung, an abnormal collection of air between the lungs and chest wall. If a patient comes to you with the following symptoms like less than average growth, attacks of shortness of breath, decreased feeding in the newborn, consistent inability to exercise, he might be having chronic heart or respiratory disease, which is long-term diseases that affect the heart or respiratory organs, such as cystic fibrosis or heart abnormalities. If a patient comes to you with the following symptoms like range from wheezing and rapid breathing to gasping, turning blue, and losing consciousness, typically beginning with a gag, gasp, or cough. He might be having foreign body aspiration, which is accidentally breathing in a foreign body that blocks airways. So that was all about today. Keep following sqadia.com for more such videos.